Next, we're going to have our survivors share their lived experience and what they have been through on their journey. First, we have Bill Cobbs that's going to be speaking, and he has a history of skin cancer.
Hi. Bill Cobbs, and in 2019, we had just gotten back from my son's wedding, and I noticed a spot on my leg, and it wasn't discolored or anything, but it was something that had, over a few months, gotten a little bit more physically identified. And unlike the shot that he showed, mine hadn't changed colors yet. So it was a normal color. It was just slightly raised. So I went to see the dermatologist. And the initial view was that it was nothing. But just to be sure, he called in someone else who took a look at it. And they said, well, let's be safe. Let's do a biopsy. And, the biopsy determined that it was Merkel cell cancer. Now, my Merkel cell was probably a result of being on immunosuppressive drugs for 7 years. Because one of the things they tell you is that you can develop cancers that would normally be beatable by your body's immune system if it was intact. Mine wasn't intact. And so, like most people, when I got the diagnosis, I was scared, and I wanted to know. I wanted to know how much time I had. And based upon my overall health condition and everything, they said, well, realistically, we think plus or minus, you've got a year. Well, that was mind-boggling. So I had the surgery to remove the spot, and then I had to wait a few months for my surgical site to heal, and I started radiation therapy, which was every day for 6 weeks. I wasn't eligible for chemotherapy because that was counterintuitive to my immunosuppression regimen. And the first year went by, and no reoccurrence, and I was still alive, so I was ecstatic. The second year went by, and there was no reoccurrence. I was even more ecstatic. Oh, I forgot to tell you something. 2 months after my surgery for Merkel cell, I got diagnosed with renal cancer. So I had both Merkel and renal. I'm 5 years out, and knock on wood, things are going in my way. But I've got a 22-year plus medical history with the University of Michigan. And I got to tell you, those people have kept me alive. I don't know that if I had been dealing with another health organization that I'd still be alive. Because the reason I'm on immunosuppressants is I received a heart transplant at the University of Michigan 13 years ago. So if I showed you my health history, you say no one person should have all of those things, but I'm still here. Thank you.
Bill, may I ask, did you run into any barriers as far as your healthcare?
That's an interesting question. One of the things that I discovered in this journey is that there's a reason that the doctors and healthcare providers ask you personal questions about yourself, and I think that one of the reasons I didn't run into a lot of the bias issues that I know exist is because when somebody asked me what I did for a living and I told them, they'd say, when they said, well, how'd you get there? And I told them I'd been an officer in the Navy. So I was atypical from what they were used to. And one of the things I discovered is that just like anything else, medical relationships are about getting to have a relationship And the more that people know you, the more they become invested. So I'm a big believer in making sure that the people who treat me know me as a person. And that can be very difficult when you're a minority because you don't necessarily trust the system. And it's hard to put your whole being into somebody else's hands and trust that they're going to do great.
Thank you. Next, we have Jason Miller, who is a survivor of prostate cancer.
Okay, so my journey began 2018, complaining of the symptoms of prostate cancer, the normal symptoms. So I was affiliated with another healthcare organization at the time, but then in 2022, latter part of 22, began to have some really troublesome symptoms that were just really getting on my nerves. And so I went back to my doctor, and they finally gave me a biopsy of the prostate. And come to find out I had prostate cancer, which was pretty aggressive at the time. So at the time, they were only going to give me a CT scan of the stomach and to see if the cancer had spread in the stomach area, anywhere else in the pelvis. But then it became to be very, very troublesome to get an appointment to get those labs taken, right? So my labs were supposed to be taken on that Tuesday. They had got paperwork in the doctor's office and sent it. So out of frustration, I just called one of my good friends who happened to know Dr. Salami here. So Jason, have you thought about having another consultation, getting a different opinion? Said, no, I hadn't thought about it. I trusted this healthcare center to take care of me. So I went to Dr. Salami, and that's when things started to change. Right? So from the very beginning, he ordered a PET scan for me, which the healthcare system not going to order me. They only considered with looking into what was local, okay, not examining the total. But amongst ordering that PET scan, we also found metastatic thyroid cancer that had two lungs. So by University of Michigan's thoroughness, checking me from head to toe, we were able to correct other issues. So not only was I able to get treated for prostate cancer, but also for the thyroid cancer. And I can say from the problems that I had up until that point, when we talk about racial disparity in prostate cancer, is the dismissal or the downplaying symptoms. So I have been complaining about these symptoms since 2018. And come to find out, after talking to the endocrinologist here at the University of Michigan, she's looking at my health history and how tested I've been. She says, number one, you've been to too many urologists in your young life, that you should be having this many urologists on your medical residence, so to speak. But then two, something should have been done with you in 2018. I said, well, what do you mean? He said, well, your number doubled here in 2018. Even though it was a low number, still concerning with years range, the number almost doubled. Something should have been done then. So I got to thinking back of when I started complaining about these issues. That went back almost 5 years. And I just remember the conversations. Jason, you're getting older. This is something that you should look to me getting closer towards the 50s. I was only 44 at the time. This is just something that really plays the Black community. Probably have to get used to it. Right now, we're just going to look at these numbers. You're just going to watch them, monitor them, and you should be. Well, all of that turned out to not be true, not be fun. So I had to step out of that health organization, come to the University of Michigan. So when we talk about racial disparities, I didn't have a problem assessing quality healthcare. I had access to the M4s, to the lomas, the Corwells, the Ascensions I did. But the care that I received from them was not adequate. It was a downgrade in a sense, what I was saying. So I just thought that in Michigan, they took it seriously. They looked at me from head to toe on other issues, and now I'm recovering.
If you were to give advice to other people, what would your advice be?
So my advice is to be an advocate for your own health. Okay, sometimes it's not necessary to get a second opinion, but if you know that you don't feel comfortable with the explanation, or you think that they're downplaying what you're saying, get a second opinion. Also, please know your family history. It doesn't necessarily mean that because I have prostate cancer or someone has skin cancer or any other disease that I'm automatically gonna get it because of me being related to that person. But there are a lot of things that you should watch out for socially. There are a lot of things that we eat, things that we expose ourselves to that can contribute to those cancer cells. So knowing your family history, talking about that. So I didn't know that both of my grandfathers at the time had prostate cancer. That's not something that we talked about. Both of my grandfather passed away, but we didn't talk about what type of cancer they did. It wasn't even a part of the discussion. But after learning that and seeing that, okay, maybe I shouldn't have taken that TNT to that one, or those should have come down. So that is very concerning now. It's like a red flag to me now. So I talk to people in circles like, listen, you know, what is your family that may be lurking inside of you that you may be contributing to? So knowing your family history and being your own healthcare.